April is National Organ Donor Awareness Month. We are here with Dr. Julia Steinke, and you are a pediatric nephrologist.
That's correct.
What is that?
So I'm a physician that takes care of children and adolescents that have kidney disease, and I also care for those children when and if they need to go on to have a kidney transplant.
So when you do have a transplant, where do those kidneys actually come from?
So kidneys can actually come from a deceased donor, and those are received after a child or an adolescent's been put on a waiting list for a kidney, or they come from a living person. So that can be a relative or even an unrelated person.
After a kidney transplant, is there extra care or treatment that's needed for that person?
So initially, the children have to stay in the hospital for about a week or a little over a week, and they need to have very close follow-up afterward. Initially, we see them about 2 to 3 times per week, and then gradually it gets spaced out, but they'll always have to have labs done at least once a month for the rest of their lives, and of course take medications for the rest of their lives.
Is it very different for a patient that is a young person as opposed to an adult who needs a kidney transplant or requires care after one?
Yeah, so the technique is sometimes a little bit different in children versus adults. The medications are the same. Most of the time the doses obviously are different based on a child. The things that we have to deal with that are a little bit different from adults is we deal with these children as they're growing and developing, going through school, and sometimes they have difficulty when they become an adolescent and they don't want to take their medications, so they can run into some trouble at that time.